What's up, everyone? I'm Dr. Sean Burkhart of Boulder Fit Health and Performance, NeuroStrong Colorado, and the F&G Academy. Today I wanted to talk to you about the importance of concussion baseline tests, so bear with me for just a few minutes. Now, concussion is a hot topic. We read about it and see it on the news all the time, especially with pro sports going on. Millions of concussions actually occur every year. And if you've been unfortunate enough to ever experience a concussion, you know how devastating it can be. So it's important to have a comprehensive baseline test that's specific to you. That way you can get back to your current level of function, or maybe even better than you were before. Now, some doctors actually argue it's not important to have a baseline test because they've compiled a database of normative levels of functions throughout the years having monitored concussion. And I actually disagree with this because you might perform outside of that range, one direction or the other. So the test needs to be very specific to you so that when you retest, you're measuring it against yourself and not a database. Now, current baseline tests at most only measure a few different subtypes of concussion, and this is a good education point because you might not even know that there are subtypes, or to say it plainly, that your symptoms are related to concussion. Those current subtypes are cognitive function, vision, and balance. And they're leaving out a few. So we wanted to pick up those few that are missing and add them to the way we test and have objective ways to test that. And that includes monitoring your sleep, your affect and your mood, your movement, your musculoskeletal function, and your autonomic nervous system. Because we want to make sure you've appropriately healed before you return to whatever activity, return to school, or return to sport. Because the last thing you want is to get a second concussion before you've healed from your first. That's called second hit syndrome, and that's dangerous territory. Another reason we want to do baseline tests is for young athletes who might not even know that their symptoms are related to concussion. Maybe they get headaches, they can't perform well in school, or they can't sleep well. It's important to educate them so that they know when to come in and when to get help. Now, the opposite end of that spectrum is the elite level performers, whether that's athletics or even the military. They want to get back to doing their job. They have a job to do. They're warriors at heart. People depend on them. But if they aren't healed from concussion and their performance is down, that can not only be dangerous for themselves, but that can be dangerous for their team members. So again, concussion baseline testing is hugely important because you only get one brain. You want it to function as well as it can for as long as it can. So what we're going to do is make tests that are very sensitive and can detect what they're shooting for, specific. They can actually detect what we're trying to measure and be reproducible. So if you have a baseline test and you're ever suspected of getting concussion, you're getting the exact same tests in the exact same way to measure your level of function. So I appreciate you taking some time. If you have any questions or you want to learn more about any specific things with concussion, drop them in the comments below. I'll be happy to address your concerns, and I'll talk to you on the next one.